Hi, everyone, and welcome to another Facebook Live. My name is Amanda Bastos, and I am the Regional Clinical Outreach Director with Lifeskills, South Florida. It's so good to see you all. I know a few people are joining, so thank you for watching. And for those who might be joining us for the first time, just a little bit on Lifeskills, South Florida. We are a dually licensed treatment center, meaning we work with adults ages 18 and up who present both with complex clinical presentations and also substance use disorders. And we offer a full continuum of care from residential treatment, including outpatient treatment, PHP, IOP, and transitional living. Now, I'm joined today by Lifeskills South Florida's Chief Executive Officer and licensed clinical social worker, Klay Weaver. Welcome, Klay. Good to have you again on another Facebook Live.
Thank you. Thank you for having me.
Awesome. Well, Klay, we're excited to have a few minutes of your time today and are looking forward to hearing a bit of an update on Lifeskills South Florida's procedures regarding safety first on COVID-19. So can you start by sharing with us a little bit about what that looks like right now at our levels of care at residential and outpatient?
Sure. Thank you, Amanda. This has been a challenging time in the healthcare community, hospitals, nursing homes, treatment centers, all over the United States. It's just been a real challenge. And the mantra that I have given staff and talked to families about has really, we want to do two things. And first, we want to keep our clients safe no matter what so that they can heal. So safety first and healing. And then second, we want to keep our staff safe so they can provide healing. So those have been our two goals all the way through this. Clients safe so they can heal, staff safe so they can provide healing for individuals. So those have been our guiding principles, and I think we have managed COVID very well, and it's not by accident. And so I would say keeping this campus safe, the protocols, what's currently happening, it really begins before an individual comes to Lifeskills. So I'm going to back up a little from what's happening on campus and talk about how an individual gets to us and the steps we take to keep people safe prior to getting on campus. So first, we do a very arduous pre-admission screening. So we want to screen for risk behaviors. So for example, if an individual is manic and they're out in the streets, they're out in the community, and they're running around, they're not wearing a mask, they're not social distancing, they're really struggling with mania, then we want to screen for those risk behaviors. We want to screen for where they are in hot spots. At this point in managing in the pandemic, a hot spot does not eliminate someone, but it gives us information we need to make decisions on how to admit them and what protocols we need to put in place. We also want to, if an individual, say, is at a hospital or they're at a detox center, then we're going to want to ask questions of that hospital or that detox center. Do you have any current COVID cases on your unit? Yes or no. If you do have, how many are on your unit? We want to know what this individual is exposed to. Have you tested this individual for COVID when they entered? Are you willing to test them again on discharge? So we ask those pre-screening questions of them. And then we may have some individuals who they are at home. They're more withdrawn, dealing with mental health, they're struggling. And so we're going to ask their family, if they're withdrawn, does anyone come over to your house? Are they totally isolated, only around you? Can we ship a COVID test to you to test them prior to coming to Lifeskills? So we're going to do some very rigorous screening all the way through to gather up information. Then that information is going to be shared with the admissions director, with our medical director, and myself. So 4 of us are going to look at this information, we're going to dissect it, and then we go to stage 2. There's a decision to admit. Once we're talking about that individual admitting. Now we're talking about how do they admit to life skills. So first we're going to look at, is it a direct admit to the campus? And it may be that the individual has had negative tests and they're not around other people, and so they're being isolated while they're coming to life skills. That may be a direct admission. It could be that in that controlled environment we can make that decision. Or they're at a hospital where there is no known COVID cases, they've been tested, they've been isolated, and they're going to come directly. But then, even in that case, all of those individuals, we're still going to test them one more time once they arrive at campus. There's one more safety protocol put into place. Then there's the individuals who we may say, all right, they're welcome to come to life skills, but they have risk behaviors, or they are in a high-risk zone and they have been around people, they've not been socially isolating, or they're at a hospital with known cases, or a family member has cases. So we're going to, in those circumstances, we're then going to want to quarantine them prior to coming on the main campus. So we may quarantine them off campus, and depending on the information we get, we could even quarantine them on the main campus. And then there's those that we bring into life skills in quarantine, and we say because of the risk they've gone through to either get to us, or the risk they've gone through themselves, we're going to want to administer 2 tests prior to bringing them out into the milieu with the rest of the clients on the campus. And that has more to do with the timing, the incubation period of an individual with dealing with COVID. So say they were around someone who was positive, or they had high-risk behaviors and they potentially were exposed, then we're going to want to administer a first test, and then we're going to wait till close to the end of the incubation period, 5 to 7 days. We're going to administer a second test. So those individuals may have a delayed entrance coming into treatment with life skills. So those are 3 ways how people may admit to life skills, where we are screening them every step of the way prior to them joining the milieu and our life skills community. Once they join the life skills community, we then consider them a contained community. They have all been tested. Most of them have been double tested. Now they're being tested weekly, and we're administering those tests. We're keeping them safe. So in a contained community, we're now able to do things where they do not have to worry as much about their exposure to COVID among themselves. So those are some of the steps we're taking on the front end that really make managing COVID on the back end much easier for us. Then the risk becomes, you know what? It's really the staff who are a risk factor for the clients. It's no longer the clients. They are a contained community. So now we're having to do testing with staff, and we test them each week. And then we also follow rigid guidelines about social distancing, staff wearing masks, clients and staff wearing masks when they're in an individual session, also having smaller groups, spaced out groups. So we have to protect the clients now from the staff, because staff go home every night, they go home to family, they stop at the gas station and get gas, they may go to the grocery store. So these are the steps we're taking to keep our community safe. And these steps do work, they are effective.
Clearly, they do work to have a contained campus as we do. So thank you for sharing that, Klay. A few things that you mentioned, I just want to kind of circle back to. The incredible amount of thoughtfulness in regards to safety and consistency, that while we have all of this happening in our world, there's no way around that. Our clients' focus can still remain on their clinical goals and their medical goals while they're in treatment with us. And that is the focus, and that's where, you know, we want them to remain, and we'll handle the rest. And I hear that in what you've shared. And just the intentionality behind coming into treatment, that is a very thorough process from the communication on the front end, and then the review with admissions and review with the leadership team, such as yourself and our clinical director and our medical director. This is a tedious sometimes process, but it's done in order to ensure safety first. And I appreciate that. Our families appreciate that. So thank you for sharing that. I know you spoke about our staff. What, in your opinion, what has helped to, keep morale up? Because this is a very challenging time. We're all humans, right? And we're professionals in this field, but we're human first. And this is hard. Isolation is hard. The season's hard. What do you recommend? What have you seen?
Oh, wow. Well, first I would say our staff are, first of all, the staff are just like the rest of the world. Staff are not super people. We're not Superman. We're not Batman and Robin. We don't have all of these super strength. We're all going through a pandemic together for the first time. And so we talk about acknowledging your weaknesses, acknowledging your struggles. Everyone has them. The individuals that come for treatment are struggling, and more so because of the pandemic. Their families are struggling more. Our staff are struggling more. We're all struggling in some way trying to get through this. It's very difficult. So I think some of the things we've done is to be very intentional about creating a campus where we still try to have fun. We create games and activities and competition between staff, so that we may compete with one staff's group versus another. Which group does the best at social distancing? Which one does the best at keeping our protocols? Staff win gift cards. We also have competitions between the client groups. So within the client groups, they're competing against each other. So we're doing things to just bring some fun and levity into the workplace and into dealing with these protocols. That old saying, all work and no play makes Jack a dull boy. Well, that's probably true for all of us adults that are struggling. We have to do some things to bring out the smiles, to bring out the engagement, and remind people that, we're all human, we're all going through it. It's okay to stop and have a little fun and take a break from seeing everyone in a mask, seeing people at a distance. So we do those things. I think with the individuals in the community, keeping their morale high is very critical as well. So over time, we realized that individuals in our contained community were not out in a normal community. In old days, pre-COVID, we may have activities where we're going to a park on a Saturday and we're doing a cookout, or we're going to a social gathering, we're going to a recovery gathering where there's live music and other people in recovery, or we're going out in the community. Maybe we're renting out an afternoon in the theater and we're watching a movie as a group. All of a sudden, these things are taken from us. And so we withdrew and became our own community, and then that created its own struggles. So we have had to add back in some things to really engage the individuals. And so now we're doing things like in the mornings, we do a lot of meditation. We do a morning reflection where we do some readings and reflect together on recovery. We're doing those on the beach now. We get in the van. We are a contained community. We're safe from each other. We can get a couple of vans and we go to the beach and we do our readings and our meditation on the beach. We've now incorporated back in, we have our own gym at the Delray campus. Clients are coming to the gym early in the morning, or they're coming late in the evening for extra late evening gym trips. We're incorporating more physical kind of outdoor activities. Fishing. Last weekend, a group of individuals from the residential campus were doing fishing on the beach, surf fishing at 7 in the morning. And they caught enough fish that they actually did the famous Sunday night cookout at Lifeskills was fish that the individuals caught on that trip. We do kayaking. So lots of fun things that we can do. And then some are activities where other clients may struggle. They may not be able to do the physical activities or leave the campus. So for them, we're bringing activities to the campus. We've had food trucks on campus. My God, just a few weeks ago, we had an ice cream truck on the campus serving homemade ice cream to individuals on the campus. We've had entertainment, live entertainment that's socially distanced. We've had disc jockeys doing live music. We had a magician on campus. So we're doing things every day to create energy around our community. It's really critical. Thank you for asking that question.
Yeah, absolutely. It's an important part of recovery, right? In behavioral health is to have joy, to find joy, because that is what, as we like to say, one of our evidence-based clinical pathways is DBT, right? We want to identify a life worth living, and this is part of it, to bring that joy and levity to it. So thank you for all the time and effort that's gone into planning all of those events. Klay, we might have some individuals joining us who are considering the next step of care, whether it's for a loved one or for themselves. What recommendation might you provide to a family member or to a person right now who's fearful about entering treatment during this season? What would you suggest?
I would say generally, sort of thinking big picture, think about how our nation has moved and progressed with COVID. So in the early months of March and April, think about the fear that gripped everyone, the shutdown that sort of hit the nation slowly, state by state. That was a big deal. And we saw in the medical community, we saw hospitals begin to stop elective procedures, and we saw nursing homes in many cases stop admitting people depending on the community. We even saw some residential treatment centers actually shut down for several months. They just totally shut their doors and would not accept new admissions. So we saw an entire host of options medically that were very frightful and fear-provoking to families and individuals who are struggling. But I would also remind everyone that as we have progressed through this pandemic, we've now seen that many of these treatment centers, hospitals, medical providers, they're now learning how to provide services to people that are safe. I'm very proud that Lifeskills, we never closed our doors. We never stopped admitting individuals to treatment. We very quickly made the number one and most important thing for us was to learn how to manage COVID and learn how to manage the risk up front so that we could continue to provide healing to individuals and not stop that. Our mission and our vision is very simple. We want to provide the highest quality care treatment to individuals, and we have to find a way to do it in different seasons of life. In this season of life, this season of COVID, we learned how to do that. So a live example, I went to a podiatrist the other day, had to get my foot looked at. So went in, they took my temperature, they had a mask on, then they stepped back after taking my temperature, kept socially distanced. I went in to see the physician, and I was in this chair, and when I sat down, they stuck my leg through a big hole of this plexiglass. So then the physician comes in and sees me and talks to me through the plexiglass while looking at my foot and examining my foot. We were both safe. We were both masked. I received the same treatment that I would have received 8 months ago. I just received it a little differently. I received it in a safe manner. We've learned to provide treatment safely to clients, to our individuals who are with us. So I would say to families that may struggle with that fear, and many people do, I mean, think millions are struggling with that fear. It is a legitimate fear that individuals may have. Just going to the grocery store is anxiety-provoking. Just leaving your house is anxiety-provoking. So I certainly understand the fears there. But I do believe that the medical community has learned how to navigate now. So hospitals are now providing elective procedures that they were not providing earlier. healthcare providers are now providing appointments and treatment that they were not providing before. And at Lifeskills, we never stopped. So I would say to those individuals that, yes, the fear is legitimate, but we can help you, and there are individuals that can help you overcome that fear, but your loved one can be treated successfully in a safe way. And also that science is very clear that when individuals struggle with addiction and with mental health issues that go unchecked, that the longer they go unchecked, the higher the acuity and the symptomology becomes, and the more difficult the recovery road becomes. So I would encourage people and families who struggle, go ahead and get your loved one into treatment. Let's get it started sooner than later. They're still going to go through the same safety protocols, but we can get this treatment started now.
Absolutely, Klay. Well said. Well said. I, again, appreciate the intentionality in that, the pivoting, right, that everyone has had to do during this season to adjust, adapt, and continue to make change possible. And we believe at Lifeskills that people can change with the support of compassionate and nurturing caregivers. That is our mission. That is our goal. And we're grateful to the leadership, such as yourself, Klay, for, leading the charge and being willing to adjust as necessary. So thank you for your words, and thank you for your time. If anyone has any questions about Lifeskills South Florida or our levels of care, our clinical care and medical care, or our COVID procedures, feel free to reach out to myself or to Klay Weaver. We are more than happy to answer any and all questions. Thank you so much for joining. Take care.